Hello, my name is Heather Cruz and I'm a nurse in the Surgery Center. I've recently joined the Safety Council to help create some new procedures to increase the safety of our patients and staff. The purpose for this video is to introduce all patient care personnel to the new procedures for approval that we hope to use to calm patients that may be upset in an effort to avoid physical and chemical restraints as much as possible. It is important for all members of the healthcare team that may come in contact with patients to learn this new procedure. From the nurses who spend the most time with the patients to lab techs, pharmacy, physicians, environmental staff workers, anyone who works in the hospital that may be on the patient care floor needs to learn this procedure. You may be wondering why this is important to you. In 2013, Anthony Sammy estimated that 1 in 17 people suffer from some sort of mental health illness, which increases the chance for a violent outburst. So you never know when you might encounter a patient that you need to help calm down to prevent harm to them or yourself. Healthcare providers have a duty to do no harm and to use the least invasive intervention possible, as noted by Edwards in 2011. That is why we want to avoid restraints whenever possible and have developed this process. The strategy and rationale are as follows. First and foremost, when you know a patient might be getting agitated, you need to proceed with caution. This is where we will begin to implement de-escalation techniques in an effort to try to calm the patient down to prevent restraint usage. In 2013, Tischler et al. Described some of the signs of agitation and preemptive violent behavior, such as talking loudly, using profanity, being demanding, throwing things, and not following directions. They also note that violence is more common among those suffering mental health issues like schizophrenia or substance abuse. In 2012, Richmond et al. Described the de-escalation techniques that we will be discussing here. The first active step we want you to take is to establish a lead person. This will be the only person that is speaking to the patient. The reason for this is it helps to reduce patient agitation as a result of multiple people speaking at once. This can be as simple as someone saying, "I am lead," then everyone else in the room will know that that is the person that's going to speak to the patient. Next, if appropriate, give the patient some space. This keeps both the patient and the healthcare workers safe and gives the patient the feeling of safety and having some control in this situation. If it is safe, you may also leave the room. Next, always be encouraging to the patient as they try to regain control of their emotions. Offer kind and supportive words as the patient is working to calm down. Above all, avoid using coercion techniques. This means do not under any circumstances use intimidation or threats to get the patient to do what you want them to do. This will just increase the agitation and potential violence from the patient. If the patient is a long-term patient, it's important to engage them in activities that keeps them involved and busy. This keeps the patient's mind active and allows them to avoid boredom. Boredom has been shown to lead to more incidents of violent outbursts, so we want to avoid that as much as possible. In a small study done by Anthony Sammy in 2013, he showed how keeping inpatients busy with activities and outings had a dramatic decrease in violent outbursts. In 2010, Begane et al. Talk about the importance of having a standard way of getting help if needed and also the importance of all staff knowing their institution's plan. That is why our last point is, if these de-escalation techniques do not seem to work, it is important for all staff to know how to alert security and receive additional help that is needed. For our unit, that would be to call or have someone else call security at extension 6695. While it is our hope that this step will never be needed, it is important to keep it in mind as staff safety is a top priority. Because our surgery center is a small unit, it's important that all staff know where all phones are located, which include patient rooms and the hallway between patient rooms and at nurses' stations. If someone hears a nurse who is engaging a patient call out for help, you need to be able to immediately pick up a phone and call for security. In larger facilities, it may be prudent to have a panic button, but at this time, we do not feel our small surgery center warrants that. The plan is to implement this process over a 3-month period. We will be doing some role-playing activities as well as watching some videos with different scenarios and give you some practice and visual examples. It is the hope that at the end of this 3-month training period that all healthcare personnel are familiar and comfortable with the protocol and can enact it with any patient that may need it. We appreciate your time to watch this video and hope this plan gets approved for usage. Thank you.